So this video is all about the Autism Partnership Method, or the AP method, and that's what we do when we're working with the children here in our office and how we train our staff what to do. And over the years, we've really evolved our approach tremendously, and every year there's new advances, differences, programs, different approaches to what we do with the children. ABA can be very, very protocol driven, and what the staff need to do is very preordained. And the goal is to write down exactly what's going to happen in the session. We believe that there's definitely a room for clinical judgment and in-the-moment assessment, which is a little different. We try to work with the child who's in front of us, and based upon their responses, based upon what they do in the session, we're going to make changes and we're going to make adjustments all the time. So we're teaching our staff how to make those judgments, how to make those considerations, not just to follow a protocol, be goal-directed, but how to maximize the progress of the student in the session, and how to really, really make good decisions and do good teaching in order to help the student learn the fastest. Examples would be, for reinforcement, we'll be assessing continually through our session whether the student likes or doesn't like reinforcement. We're making clinical judgments when to rotate those reinforcers and, what kinds of reinforcers to use. We teach our staff when to use prompts effectively based upon the student's history of failure or what they know about the student's acquisition of this task over the past week. What kind of prompt to use based upon, again, the student's performance. So we may base decisions around the student's behavior, and we may switch to do different kinds of curriculum during a session to facilitate behavioral momentum, or to facilitate success in other kinds of tasks, or to maintain attention. We're doing behavioral assessment all the time, looking at functions of behavior, purposes of behavior. What does the student want? How is the student's physiological condition today? Is he tired? Has he not had much sleep? Is he less likely to work as hard today? When do we provide reinforcement? We want to be always thinning the schedule of reinforcement. What kind of reinforcement? Is it externally based reinforcers? Do we try to encourage more social reinforcement? These are all decisions our staff may make in the moment with some general guidelines. Many considerations, which makes the kind of therapy we do, by the way, much more complicated and difficult, which is why our staff need a lot more training, because again, we're training them to really think in the moment and make good decisions. But we feel like that this kind of therapy can really help maximize the progress of the students.